I was blindsided completely, as I'm sure everyone is. I'm Cheryl Ekstrom. I work at the University of Arizona in Tucson in the math department. Within that short time between when I met with my gynecologist at year 39 and getting my mammogram, I noticed there's a little indentation on the side. Went in for the mammogram and she's like, any changes you want to report? Like, oh, I got this little divot here. Sure enough, I'm called in for a biopsy. So yeah, it was stage 2 ductal cancer. And I had a friend who messaged me and said, like, how are you doing? And asked me a whole bunch of questions about the pathology. And I'm like, I don't have the pathology report. What are you talking about? So she helped introduce me to Dr. Brooks and Linda's team, new surgeon. Between the first surgeon who said, you know, we'll learn more for the next time it comes around, to my second surgeon who said, you know, 2016 is going to be your cancer year and then you'll be cured. I'm going with that. So she really turned it to a game on type of attitude.
So I'm Linda Moores. I'm a PA in Tucson, Arizona. 27 years in oncology. I'm affiliated with a OneOncology practice, Arizona Blood and Cancer Specialist. And we're mostly a breast practice, although we do a little bit of everything. So typically I meet a patient on the first or second visit, and with Cheryl, it was her second visit. She met with the physician that I collaborate with, Dr. Robert Brooks, and he kind of laid out the landscape of what she needed. She would need chemotherapy first.
From there, we discussed we'll do chemo, do some surgery, a lumpectomy just to clean out the area, and then radiation therapy to get any rogue cells, and then, you know, continue with the hormone therapy. 2021 was when I signed up for my first Ironman. A lot of it was because I just knew I had to have some goal to keep me moving. Well, I didn't do it my first attempt, and I figured at that point it was going to be, this is my stand up to cancer move. Like, you know, you're not going to keep me from this. Originally, I was supposed to be on endocrine therapy for 5 years, and then suddenly it's like, well, it sounds like the research is now saying closer to 10 years. But then when I found out that BCI could tell me that maybe I don't need 10 years, like, hot diggity. Yeah, I really want to find that out. The BCI results showed us that I was not likely to receive any further benefit from continuing to take letrozole. And what I would be getting then is just the side effects from it.
So it changed my recommendation for extended endocrine therapy because she was less likely to benefit from staying on drug.
Having that extra information, I feel confident that, okay, we are ready to close this door.
When you have a patient like Cheryl, my bias is she's high risk. And while I don't think that's incorrect, then BCI really overrides my bias and allows me then to say to her, listen, you've done all the chemotherapy, you did the radiation. Now really 5 years of endocrine therapy is adequate. You're really unlikely to benefit from further therapy. And that, again, I think that allows you to personalize how you treat her versus everybody just gets, you know, chemo, rads, 10 years of endocrine therapy because I'm worried.
After getting my BCI results, if I could sum up that feeling in one word, I would say relief. Relief that I don't have to take this daily anymore. You know, it was relief that my cancer treatment is pretty much over. I feel like I'm now fully back into life. I finally trained for and completed my first Ironman. And finishing that race, first of all, finishing the Ironman was a huge goal. So being able to complete it is one thing, but that really felt like my FU to cancer. I was able to complete this race despite cancer. And having completed all of treatment, I am here, I am back, I'm ready for my next one.